Thank you so much, sir, for showing us that the wet lab is where shaky hands become steady. May I invite Dr. Devika to kindly present a token of appreciation to Dr. Yogesh. Every postgraduate begins their journey standing quietly in the corner of the operation theatre, simply observing. But observation alone is not enough. The real transformation happens when that observation is converted into active learning. When every step, every gesture, every decision of the surgeon is absorbed and understood. And to enlighten us further on the art of moving from passive watching to active learning, I am delighted to invite Dr. Sarita Gonsalves.
So very good morning to one and all. At the outset, I would like to thank Dr. Rajni, Dr. Ajay and the entire team from AJ for giving me this opportunity. So the NMC has given us several guidelines as to how we can go about surgical training for postgraduate ophthalmic surgeons. So this talk is primarily directed towards them. So before we go on to all of that, first things first. So having finished your MBBS and then having gone through the rigorous process of NEET training, giving your NEET exams, and finally you've made it here, but then slowly the quiet reality strikes. So your postgraduate course is a 36 months course as per your curriculum, wherein your first 6 months go into initiation, induction, getting to know the department, and your last 6 months you spend as an exam going postgraduate, wherein you're busy preparing for your exams. So effectively you can do the math. You only have about maybe 20 months where you can get your skills right, with all your couple of holidays, some people getting married in between. So all of these things effectively leave you with only a short period of time where you can master your ophthalmic skills. And just like Yogesh sir says, all of us consider this ophthalmic surgical training quite different from general surgical training, if you see. Okay, it's like mastering your piloting skills basically. So it is as fine as that. So as per your MCI postgraduate medical education program, we are supposed to produce competent specialists. So what do we mean by this? At the end of your 3-year course, you're supposed to carry out your OPD as well as your surgical duties professionally and ethically. For this, they have given us some broad guidelines. So medical colleges having postgraduates are supposed to have a standard curriculum. They're supposed to have modern equipment, a conducive learning environment, and of course a peer-reviewed quality assurance programs. But what I feel is that we normally stress on procedures, some which are outdated, like your ECC, maybe a small incision cataract surgery, pterygium, dacrocystectomy, enucleation, evisceration. These are the procedures that we generally concentrate upon. The procedures generally neglected are phaco. Now, of course, we are giving a lot of importance to postgraduate training in phacoemulsification, squints, trabeculectomies, dacrocystorhinostomies, and retina surgeries. So these are the surgeries that we do not normally give importance during our postgraduate course. So dilution of these surgical exposures and experiences are becoming more and more challenging. So what the postgraduate should learn and how they should learn it, there are no fixed guidelines. So even the teachers are finding it more and more difficult, and surgical training of postgraduates is becoming more and more challenging. As sir said, even your camp patients have their own demands. So you cannot consider an eye to be an experimental eye anymore. So you have to be well versed when you get into your OT with all your skills beforehand itself. So your appropriate, as per your first year, second year, third year, there are a certain skills that you can master every year, so that when you pass out, you can be a competent surgical ophthalmologist. So what we used to consider earlier was the Halstead's methodology. So this means that intense repetitive procedures under supervision of a qualified surgeon will make you a qualified surgeon. That means every postgraduate was known to perform a predetermined number of procedures. As you can see there, the cat is repeatedly performing the procedure under supervision. But does it mean the cat is a competent surgeon? No. So it is not only the numbers that matter. It's not the quantity, but the quality. So every case should be a learning experience. The mistakes that you do in your previous cases, you should work upon them and try to improve. So as you know, the number of cases are falling short. Every case should be a learning experience for you. So there are several modules that describe what a passive learning is and what compared to an active learning. What is passive learning? Passive learning is how an undergraduate would view the ophthalmic surgery. So there is no structured engagement. There are no specific learning objectives. As a postgraduate, your learning should be active. So it should include asking questions, having guidelines, guided observation tools, engaging yourself in briefing, debriefing, and thereby acquiring your skills. So the NMC has given several guidelines, and the MEU these days, just like in other surgeries, so these sound very complicated: flipped operation room techniques, progressive involvement in procedural skills, engaging students, all of these. So I've tried to simplify this and have put it across as to how I would like my postgraduates, or how we were trained as postgraduates. So you should start getting involved with the patient right from the planning. So what can you do? So as a postgraduate entering the OT for the first time, first of all, you should plan what kind of procedure you're going to watch, what procedure you're going to learn on that day. What are the instruments that you would require and how to handle? Very, very important, how to handle, because you do not want to go into the OT and waste time trying to hold those instruments or trying to manage the handling of those instruments. All the sterilization techniques that go into it, how to position your patient in the operation theatre, how your assistants should be positioned in the operation theatre, the skin sterilization, dressing and closure, all this should be planned well in advance. Followed by deciding the venue. Now, if you have a chalazion, probably, you would want to do it in the OPD. You wouldn't want the patient to be taken to OT. Similarly, there are certain procedures like your intraocular procedures which have to be done in the OT. So a postgraduate should know what are the procedures that can be done in the OPD, what are the procedures that you have to take the patient to the OT. Knowing how to drape your gown, wearing your scrubs, your sterile gloves, okay, and how to go about all of this should be learnt well in advance. The third thing is reading a standardized procedure book before you get into the OT. So all variations, all techniques involved in that procedure, the pros and cons of different techniques, if you're thorough with, then life becomes very easy in the OT. Also read about the complications that you may possibly encounter, as well as get involved in the consent taking and the details of the consent. The next would be how to go about observing the OT or observing the steps in the OT. Again, once you're in the OT, keep all the prerequisites ready. For example, how the sister sets up the table for you. Watch, because it should not be that, once you pass out, you do not know. Many a times we have a high turnover of nurses in the OT or OT assistants. So every time you encounter a new nurse or a new OT assistant, it shouldn't be that she tells you what to do. Most of the times you should know where the instruments, how to set up the phaco machine, how to connect the probes. All of this should be learnt during your post-graduation itself. So meticulous step-by-step observation and registration of the steps, as well as following up. So we have OR screens or the side view mirrors where you can actively get involved in the procedure. Sir has already elaborately spoken about wet lab discussions and workshop. Take active participation, because the more number of wet lab cases you perform, the more competent you are and the less nervous you are when you're doing it on the patient yourself. So get a clear perspective of how you should go about. So that's why you need to practice a little bit of skills in the wet lab. So it could be either knowing your IPD, interpupillary distance, know how the optics of the microscope, how the foot pedal works, how you can focus, how you can change the depth, and then also practice other things like tying the knot. Nowadays, of course, we do not do much of suturing, but you never know when your tunnel goes deep or superficial, when you have a wound leak at the end of surgery. It is a must that you should know basic suturing techniques. Okay, get hold of, as sir said, nucleated eyes, enucleated eyes, etc. to do your practice. And of course, you have wax size, and being persistent and consistent is the key, finally, to end up having good surgical hands as we describe it today. So for undergraduates, I think in the first year, even doing small steps like peritomy, cauterization, removal of the lens, closure, these things mean a lot. So start off doing those procedures in your first year, so that gradually by the end of your second year and final year, you will be able to perform independent surgeries. Do not panic when you see bleeding from the surgical site. So all of this are important to make your OR time valuable and meaningful. So then you move on to performing the procedure under supervision. So get involved with the patient right from the start. When the surgeon counsels the patient, make sure you're around. Get involved in the pre-operative workup, getting to know the IOL power, the differences in the different types of IOL. All this should come during your postgraduate training itself. Follow standard protocols, and most importantly, stop when you're in doubt. Okay, in the surgery, in ophthalmic surgeries, there is no second chance. So you cannot go to the point where you have no return. So stop. When you know something is going wrong, call your superiors. I'm sure there's nobody who will say no to help you out. And of course, also stress on documentation, post-operative notes, post-operative orders, all of this should be stressed upon. And finally, you go on to independently operating on the patient. So select simple cases in the beginning, maybe a well-dilated pupil, a lesser grade of cataract, a very cooperative patient. This is very important to make your life easier when you're starting off. So keep in mind, always there is scope for learning. So see how every case you can improve when compared to your previous cases. Maintain a logbook. All of this is going to help you in the long run. So with this, I would like to conclude, but there are a few things that you have to learn as a postgraduate itself, because it will help you as a ophthalmologist in the long run. That is developing professionalism right from the beginning. Know how to talk to the patient. Okay, develop your ethical skills, your communication skills, which I feel is lacking in today's generation. Try to do that as and when you all are postgraduates itself. And all of this, along with your knowledge of medicine, I'm sure will help you go a long way. So all the best in your surgical journey. Thank you.
Thank you, Dr. Sarita. You've proved even when we think we're just passing instruments, we're actually picking up surgical wisdom one gesture at a time.